All right, welcome everyone. Thank you so much for that introduction. Like I said, my name is Dr. Baumgartner and I am a clinical neuropsychologist. Basically, I study the relationship between the brain and behavior, specifically related to our thinking and our memory skills. And I get this question all the time when I see my clients. My memory isn't what it used to be. Is this normal, doc? A lot of my patients are kind of worried. Do I have dementia? Do I have Alzheimer's? What's going on? I'm noticing these changes. So today what I'd like to talk about is what normal cognitive changing is with regard to aging, what lifestyle choices we can do to promote normal cognitive aging, and when to refer to me like a neuropsychologist. I do not have any disclosures to disclose today, no financial relationships. I'm not going to be talking about pharmaceutical medications. For my outline, I'm going to be talking first about that silver tsunami that's coming. We in our field tend to joke about this, but it actually is quite real that we have this huge aging population, and the proportion of our population that is aging is consistently growing, and this is something that we need to be mindful of. Next, I'm going to talk about what those actual cognitive changes are in normal aging, and then we're going to talk about the actual brain changes that happen, and a little bit about what the difference between normal aging and dementia and mild cognitive impairment is, as well as those lifestyle choices to promote normal aging. So first off, who is old? I sometimes think I'm old, and I'm 32. But basically, what we're going to define today as the normal aging population or the aging population is anyone over 65. At the very bottom, we have something called these super agers. Basically, these are individuals who are 95 years and older who are still cognitively intact. And in our field of psychology, we're really trying to understand, how do they remain cognitively intact? What are lifestyle choices that they did? How do we promote and make sure that we get to be a super ager as well? So with this demographics, why is this important that we're talking about it? Well, basically, there's an exponential growth of individuals age 65 and older. The baby boomers are getting older, and they are living longer with medical advances. Basically, after World War II, everyone started settling down, having families. They're getting older, they're living longer, and they're having problems with their cognition, so we need to be mindful of that. I'm a visual person, so we have this nice little graph here. Basically, just on the top describes the millions of individuals that's projected to be 65 and older. By 2050, this is going to be 80 million individuals living in the United States alone. It's going to be 20% of the US population is going to be 65 and older by 2050, so we really need to be mindful of this. So what are the normal changes with regards to our cognition when we age? We're going to go back to the 60s a little bit and think about Cattell and Horn. And they had this great theory on intelligence. And basically what they did was they broke down intelligence or our cognition into two factors, something called crystallized intelligence and fluid intelligence. Crystallized intelligence is basically anything that's acquired through our education, through our cultural experiences. These are things that are taught. These are skills and acquired of knowledge. And what really happens is that this stays the same. This tends to plateau at around 60, but actually people are learning new things every day. So you could be 80 years old and still learning something new. Versus fluid intelligence. This is kind of things that are influenced by our genetics, our biology. We really can't change that. How fast our brain processes information, our memory skills, our ability to problem solve. And unfortunately what happens is this peaks at the third decade. And again, I'm 32, so I'm at my height right now, and it's all downhill from here, but that's okay. But basically, this is very natural, gradual changes that occur. And I'm going to talk about two of the biggest changes that people talk about in normal cognitive aging. So we have a nice little graph here to demonstrate that normal decline in fluid intelligence as we age, and the plateau and nice maintenance of crystallized intelligence. So the first thing that really we want to talk about is something called processing speed. Basically, in order for our brain to even do anything with information that it receives from our five senses, we have to be able to perceive that information, hold on to it, and process it. Basically, it's how fast the gears are turning. And this naturally declines as we age. And this is influenced by our senses. So as we age, our vision declines and our hearing declines, which then has downstream impacts on our processing speed. And processing speed is kind of like the foundation of our cognition. It's kind of like if our cognition was a house, processing speed would be the foundation. Everything else builds on that. So if you're slow with initial processing speed, your memory is going to be a little bit slower, your problem solving is going to be a little bit slower, and that's normal, natural, going to be changing and aging. The second thing that everyone talks about is memory, okay? And I like to think of memory like a piggy bank. You know, you have that top of the piggy bank where you have the slot. You want to deposit or encode or, this is the information I want to learn. That naturally changes as we age. Our acquisition or our learning curve actually just generally declines, normal with aging. Then you got that body of that pig. I want to store this information. I want to hold on to this information. This does not change with normal cognitive aging. In fact, the most common cause of dementia, which is not normal aging, by the way, is Alzheimer's. And Alzheimer's impacts the storage. Alzheimer's literally takes cracks and puts it into your piggy bank so that you're rapidly forgetting information. Then you got that bottom of the plug of the piggy bank. You pull that plug and you want to retrieve that information. That also naturally declines with age. Nothing to be worried about. We also like to think about memory in two different ways. We think of it as implicit or explicit information. Things like implicit would be being able to remember how to cite your ABCs or sing the alphabet, or being able to ride a bike, like procedural memory. This doesn't change as we naturally age. However, there are natural changes that occur to explicit memory, our ability to remember conversations or remember autobiographical information. That normally changes. So here I just have some examples about what a typical normal change would be versus an abnormal change with regards to different types of thinking and memory skills. And again, there's going to be some natural word-finding difficulties, or you might forget occasional details of a conversation. But if you're forgetting whole events, if you're forgetting entire conversations, if you are substituting words and having changes in your speech, that is not normal cognitive aging. You need to come see me. All right, so what's the difference between normal aging and dementia? What is that word anyways, okay? So normal natural changes occur as we age, that's good. But if your changes in your cognition are greater than what would be expected with normal aging, but you're independent in your ability to function, something called instrumental activities of daily living. If you're independent, you can manage your checkbook, you can manage your meds, you can still drive, but you have cognitive decline that's greater than normal aging, that's consistent with something called mild cognitive impairment. If that cognitive impairment then starts impacting your ability to function independently, you have difficulties with driving, you need help with your meds, you need help with your finances, you have just moved over to dementia. I like to think of dementia like a syndrome. It's an umbrella term. Basically, it just means there's a change to your thinking skills that's impacting your ability to function independently. The most common cause of dementia is Alzheimer's. Alzheimer's accounts for about 40 to 70% of all the causes or etiologies of dementia. All right, so what are the normal brain changes that occur in aging? When we think of the brain, it's broken down into these cells called neurons. And neurons have a cell body or soma, and they take information in through the dendrites, and then it shoots the information down the axon. And the cell bodies are in the outer cortex and the subcortical structures, the very deepest structures of your brain. That's where those are housed. And then the connections, the axons, are in connecting them to, and that's called white matter. There are natural changes that occur to our gray matter and our white matter as we age. Our gray matter changes in that the size of the neurons change and their synapses, their connections with other neurons change. But normal aging does not mean cell death. This is something that's a little bit tricky to understand sometimes, but it's not actually that the cells are dying. It is that their dendrites, their information portals where they take information in, that is kind of changing a little bit, and the size of the cells are changing. Normal changes for the white matter tracts. This is a volume decline, but again, the cells are not dying. So what's happening here is it's most common in the prefrontal cortex, which is the front part of your brain, as well as the connections between the right and left hemispheres called the corpus callosum, basically how the right and left sides of your brain communicate. There's natural changes that occur here as well. And this is hypothesized to actually be the cause of normal cognitive changes to your memory as you age. So what do we do to try to promote healthy cognitive aging? The big three takeaway: we need to stay cognitively, socially, and physically active. This is the big three that I talk about with all my patients. Even if you have cognitive impairment, you can still promote healthy aging, okay? And it doesn't matter what you do as long as you're doing something, okay? So the worst thing you could do for your brain is to sit in a dark room and do nothing and isolate yourself. So with physical activity, the American Heart Association recommends 150 minutes of moderate intensity exercise and 2 days of strength and balance training during the week. Okay, a little is better than none, but we want to try to work towards that guideline. And basically what we found is that people that are physically active have better cognition. And this actually increases the neurons, it increases the synapses, the connections between the neurons, and it helps promote blood flow. Socialization is very important too, okay? Loneliness in itself, by socially isolating, actually causes stress to build up in the brain. It causes your HPA axis to actually go off. And that in itself releases cortisol, which then can cause inflammation. So loneliness in itself is a cognitive killer, basically. And so we want to be promoting socialization, not isolating as we age. This gets to kind of the quality versus the quantity. Older adults, research tends to suggest that they prefer more quality relationships as opposed to younger adults. They want all those clicks and likes. They prefer more of a social support network that has a bigger quantity. And then the last thing is cognitive reserve. This relates to basically what are some elements or aspects of a person that makes them less likely to develop cognitive impairment, okay? And Stern came up with these theories. And basically he found that people that have higher education, people that have a higher social economic status, and that have a higher baseline G, which is just your intelligence factor, as well as those who partake in certain activities, have a higher cognitive reserve, which means that they're less likely as they age to develop cognitive decline. Okay, this is, again, it's better to do a little than to do none. And the thing that they talked about is something called the scaffolding theory. So there's actually studies that are suggesting that if there's a certain disruption in the network, that maybe because of other networks, your brain can kind of take on and reroute or detour that information to being able to be moved in your memory systems. And there's some hypotheses about that. But overall, you should always refer to neuropsychology. I am a little bit biased here because I'm a neuropsychologist, but it is our job to use objective measures and normative samples to actually compare your performance on my tasks to your peers. It's close to the same age, race, gender, and education, and I can answer that question and say, this is normal aging versus something else like dementia. We can also track you over time and help with assisting with recommendations with occupational therapists, physical therapists, psychologists, therapists, everything like that. So in summary, there are natural normal changes that occur to your brain as you age. They most likely impact the processing speed and your memory systems. Dementia is not the same as normal cognitive aging. Dementia is not normal aging. There are changes to the brain structure as you age. And again, it's very important, the lifestyle hypotheses. Stay physically, cognitively, and socially active. Thank you.